Washington State has now seen its first death attributed to the Johnson & Johnson COVID-19 vaccine. So thanks for joining us at 9. I'm David Rose.
And I'm Jamie Tompkins. Health officials say a woman in King County suffered a rare blood clot after getting the shot. And Fox 13 reporter Olivia Lavoie is tracking this developing news tonight.
The King County Department of Public Health says a local woman in her late 30s died from a rare blood clotting syndrome known as TTS. The health department says she died on September 7th after getting the one-dose vaccine about 2 weeks earlier. Public health agencies have not named the woman, but an obituary for Jessica Wilson of Seattle says she died September 7th at 37 years old from the condition TTS. Her obituary also says that Wilson was a recipient of the single Johnson & Johnson vaccine and that the mother of two had no underlying health conditions. We're told she was a dedicated mother and wife who was heavily involved in her church and community. According to the CDC, only 3 other people in the country have died from this blood clotting syndrome after getting the J&J vaccine. As of this summer, of the 12.5 million J&J doses, there were 38 confirmed cases of TTS. Women ages 18 to 49 are considered most at risk for TTS following the J&J vaccine. The Moderna and Pfizer COVID vaccine have not had any cases. In April, the CDC paused its authorization on the Johnson & Johnson COVID vaccine to study the risks from the rare complications and ultimately determined the benefits outweigh the risks and reinstated it. Olivia Lavoie, Fox 13 News.
Health officials say in our state they are monitoring vaccine reactions very closely. In King County, health officials estimate the risk of an unvaccinated person dying from COVID-19 is 57 times higher than a vaccinated person dying from the virus.